This is Tammy Altman, and this is for the Week 5 Research Article Critique Presentation for Nursing 443 with instructor Mary Jane LaRufka. I selected telephone consultation and triage effects on healthcare use and patient satisfaction because that is what I do. I'm in the telephone triage department. I also used the University of Phoenix book, Understanding Nursing Research Building and Evidence-Based Practice, as my reference. Using this research article, strength and weakness of the study. The strength is that it really was explained well, the different, what they were looking for, how they picked their subjects, what their difficulties were, and trying to avoid the bias of the research program. Theoretical limitations, there really wasn't any. The authors gave definitions of what they were looking for, and they were looking for those definitions. Methodological limitations, however, there were several. To do a research study on telephone triage was difficult. They did a methodological search on electronic database, and it was very difficult to find enough papers to meet the criteria. And they did a second search without using the methodological search, and they found a lot more. So the research team combined the two searches, and then they had 30,437 records, and of those they found that 62 met the criteria based on key terms in the title or in the abstract. And of the 62, then they ended up finding that 9 met criteria for the review. Of the 9 studies, the 5 were randomized control studies, 3 were interrupted time series, and 1 was the CTT. A weakness of this was I don't know what a CTT is. They explained what the randomized control trials and interrupted time series, but they did not give the definition for CTT. I did look up the definition on the internet, and I found Center for Clinical Trial fit it most, but I'm not sure if that was appropriate, if that is even what CTT stands for. The research addressed evidence, research bias. Of the 9 articles, each one addressed if they had author bias. 6 of them did not have author bias or could not be substantiated. 3 did have author bias, but they concealed that bias in the study so that they could use this study. A difficulty in the authors finding enough research articles for this was that in 2007 the electronic databases were updated, and there hadn't been any more recent articles on telephone consultation, telephone triage since 2007. Telephone triage and consultation are used interchangeably in this program. They mean the same thing. One of the references in this article was from 1979, and the most current one was from 2003. This particular article was made in 2009. It was difficult to find appropriate articles. They could not combine the 9 studies into one meta-analysis because there were so many variances in the results of the study and the ways the questions were answered that they just did a summary of each of the 9 articles. There were no ethical and legal considerations that were needed because there were no human subjects in this research article. It was a historical review of, oh my goodness.